Hello everyone. In this topic, we will discuss the very important topic from the nursing point of view, that is diabetic mellitus. It's a simple topic, but it's really very important because this health condition is very popular in these days, and it's affecting many people. Diabetic mellitus. So, like even if you are writing any nursing exam, so it's important to clear your all doubt regarding diabetic mellitus. What is the function of insulin, types of diabetic mellitus, and how you can control the diabetic mellitus. So first, before discussing the diabetic mellitus, so we will discuss about the insulin. So what happen in diabetic mellitus? How it occur? So like we have insulin in our body that is secreted by the pancreas in our pancreas of our body. So what insulin do? So insulin take the glucose and transport it to the tissues of the body, like to the liver, muscles, and adipose tissue. So when there is a lack of insulin, or there is a no insulin at, so what happens? So glucose, it start accumulating inside the blood, it freely move inside the blood. So that's why when we do the blood test, so what we see is a high blood glucose level. So in what we can say in the common language, that whatever the person is eating, so it is not converting into the energy, it's converting into the glucose, because body cannot utilize the food as a energy. So whatever the food you are taking, it's end up into the glucose. So that's why the blood glucose level is high in a patient who has the diabetic mellitus. So next is very confusing and very popular topic, that is the type of diabetic mellitus. So many of the students, they have doubt that they don't know what is the difference with type 1 and type 2 diabetes. So here I will clear your doubt. So in type 1 diabetic mellitus, you can say that there is a no production of insulin at all. So it's a autoimmune disease. So in this disease, the due to autoimmune problem, there is a totally destruction of the beta cells. The beta cells are present in the pancreas, and they produce the insulin. So the person who has type 1 diabetic mellitus, he has to be on the insulin therapy throughout the life. So this person we consider as insulin dependent. So this person cannot survive without the insulin. So pancreas does not make insulin, and mostly it is a juvenile onset. Mostly it affect the young or teenager people, and this type 1 is ketosis prone, means like in this type of diabetic mellitus, so the complication is a diabetic ketoacidosis. I will make another separate video what is diabetic ketoacidosis. Actually, this is the complication of type 1 diabetic mellitus. So we will come to the point. So next, type 2 diabetic mellitus. This is the type that you see in many people, like in your families, in your relatives, and around your community. In this type, there is a production of insulin, but it's not enough. Whatever your need of your body. So this person is a non-insulin dependent. So this person is not really has to be on insulin therapy to treat the diabetic. This person can go to the oral hypoglycemic medication, and this affect the elders people or late adulthood, and there is a no any diabetic ketoacidosis kind of complications. This type of diabetic mellitus has different complications we will discuss later, and body makes a less insulin. As I already told you, there is a production of insulin, but it's not enough as requirement of the body. So next is the common type of diabetic mellitus, that is gestational. So it only occur in the pregnancy. So during the pregnancy, the woman has high glucose level. So we can say that it's gestational. So it only occur in the pregnancy. The woman who don't have diabetic mellitus, but when she is pregnant, so now she is diabetic mellitus, and this disappeared after the delivery of the baby. Next is the clinical presentation. So if you are writing any exam or if you are preparing for any exam, so I will give you a one tip here. So for clinical presentations or for the clinical findings of the diabetic mellitus, please remember 3P. So the first P is polyuria, means a person he pee a lot. Second is polydipsia, thirsty, patient feel very thirsty and he drink a lot. Next is polyphasia, eat a lot, right? So because there is a lots of glucose inside the body and the person is always feeling hunger, hunger, hunger. And next, there is other few clinical presentation apart from these 3Ps, like sorry, like fatigue, weakness, weight loss without any efforts, blurry vision, numb or tingling on the feet and hand. And there is a low specific gravity because when the person is peeing a lot, urinating a lot, so there is only the concentrated urine inside the body. So when if you check the specific gravity of the urine, it will show less. This is normal range of specific gravity. So next is the treatment. So if, there is no any permanent cure for diabetic mellitus. We can control it, we can manage it with few precautions, but like the person has to be on long term therapy, either it's insulin or it's a oral hypoglycemic. So the person who has a diabetic mellitus type 1, so in this the person has no insulin production at all. So this person should go for insulin therapy, right? So this person will have the insulin, or patient can manage the diabetic mellitus with a good diet, good healthy diet, and the exercise. But in this type of diabetic mellitus, most important thing is insulin. And type 2 on the other side, diet. Diet is the most important for this person with the type 2 diabetic mellitus. And this person can go to the not can this person is mostly on the oral hypoglycemic. ठीक है? So this person do not need the insulin therapy. So person can control the diabetic with the oral hypoglycemic, and activity means ke exercise. So exercise is important in these people. So if they will keep moving, they will keep utilizing the glucose level. So it will not accumulate inside the body. So if we talk about the like diet, so means the person should eat like non-starchy food, non-starchy vegetables and fruits, like the good food like apple, banana, grapes. These are good for, and grains like the whole grains and protein. Non-fat or low-fat diet is good for the diabetic patients. Next is the complication. So when a person is diabetic mellitus, either the person is on insulin therapy or either the person is on oral hypoglycemic. So they always have on and off period of hypo or hyperglycemia. If due to any condition the person is getting insulin or the oral hypoglycemics, but uh, not taking the enough food, right? So what happened, so there is a hypoglycemia. But in some cases, sometimes if person skip the insulin dose or person skip the oral hypoglycemic and eating the food that can lead to the high glucose level, then a person can have the episode of a hyperglycemia. So the patient who have this disease condition, they must know what is the sign and symptoms of hypo or hyperglycemia, so that they can cure this complication at home, because these are the acute complication and these complications need immediate treatment. If the person is diabetic mellitus and he's feeling sweating, sleeping, trembling, irritability, hunger. Why hunger in hypoglycemia? Because the body wants to compensate, right? So the skin is getting paler. So means this person is having the um, hypoglycemia episode. So if it's not treated on time, it can lead to like disorientation, loss of consciousness, and seizures. So in this patient, uh, this the patient who have diabetic mellitus, they should have like sugar or sugar cubes or candies in inside their bag or inside their pockets all the time, or glucose tablets. So if the patient have hypoglycemia symptoms, so we recommend that the patient should have the glucose tablets, or take the tablespoon or 4 teaspoons of the sugar, or 4 sugar cubes, or honey syrup, or patient can take the low fat milk, like about 8 oz low fat milk, or patient can take the fruit juice, like orange juice, half cup of fruit juice, any fruit juice. So all these remedies can help to treat the hypoglycemia immediately. On the other side, if the person has hyperglycemia, so for example, if person skip the dose of the insulin of, or there is a stress days, means like person is sick, there is an infection, right? Then the blood glucose level get very high. So we can say it hyperglycemia. So in this, there is a patient will urinate a lot, there is a dry mouth because patient is urinating. So it's kind of patient is going to the dehydration condition, and if patient is getting dehydrating, there will be weakness, there will be headache. And patient is getting dehydrating because of urinating a lot, then patient will be thirsty, and patient will get the blood vessel. So this condition we can treat with insulin, or if it's a severe condition like IV insulin or the normal subcutaneous insulin. Or we can advise the patient not to skip the insulin, not to skip the oral hypoglycemic, and there will be a need to check every 4 hours glucose level when patient is sick, there is any infection, or there is any stress days like before surgery, or the if the person have any examination or something, right? So in those days, patient should need to increase the dose of the insulin or oral hypoglycemic, and also do to check the frequency of the glucose level. But there is also the long term, because this is a chronic disease condition, so there must be a chronic disease conditions also. Over the time, glucose level that is freely moving inside the body, over the time it affect the retina also, it affect the neurons in the body, it affect the nephrons inside the kidneys, it also affect the blood vessels, arteries, those are providing providing blood circulation, or the cardio vessels. The blood glucose over the time, it affecting those vessels, it making the plaque formation. So that's why it leads to peripheral vascular disease. And it also over the time it can make the clots that can lead to the stroke inside the patients. And it also affect the small blood vessels and the capillaries inside the body, that can lead to the gangrene food. So whatever the glucose level, it's glucose freely moving inside the body and accumulating inside the blood, so it affect almost every organ of the body. So it's really very important to control the blood glucose level with a diet, with the exercise. So we can also discuss this management and preventions, right? Healthy diet is the cure for almost every disease condition, or to prevent the occurrence of most of the disease conditions. Good weight management can also help to maintain the blood glucose level and to prevent the occurrence of diabetic mellitus. Exercise, frequent blood glucose monitoring is a early detection of hypoglycemia or hyperglycemia. Patient education and support, so educate the patient about the exercise, never go for a barefoot, and take care of the toes. Always go for the professionals person for the toe cleanings, or no nail cuttings, or if there is a there is anything happen, any small cut, take care it properly. Always cover the feet, never go barefoot in outside. Pharmacological therapy, so whatever according to disease condition, if it's type 1, uh, make sure to take your insulin, and if you're type 2 diabetic mellitus, make sure to take your oral hypoglycemic along with diet and exercise and good activity. So maintain a healthy healthy lifestyle so that you can prevent the complications in the future. So this was all about the diabetic mellitus, right? The what happened in diabetic mellitus, the clinical findings, treatments, and type of the diabetic mellitus. So we also discussed acute and chronic complications. So this was all about diabetic mellitus. Please subscribe my channel. That is our income score. In this, I will post videos regarding the nursing content, and I hope I will make the next video on diabetic ketoacidosis, that the complication of diabetic mellitus. Okay, thank you so much. Please follow my channel and subscribe me on the YouTube channel. Thank you.